Okay, welcome everyone. Thank you for joining us from wherever you are. This is the official kickoff of the Fall 2020 DiabetesMine Innovation Days, which includes today's program, our annual Innovation Summit, and tomorrow, our biannual D-Data Exchange Technology Forum. So for those who don't know me, I'm Amy Tenderich. I'm an advocate, journalist, blogger, and creator of the DiabetesMine Innovation Project. Those of you who've been on this journey with us for a while know that this is a patient-led initiative, and it's all about gathering patient, industry, clinical, and thought leaders to talk about innovations that help improve life with diabetes to make things better for all of us. So normally we've been doing these events, as you may know, since 2011, and we normally host our Fall Innovation Days at Stanford School of Medicine or at UCSF Mission Bay Center. And it's really all about bringing together a unique mix of patient leaders from industry, clinical care, regulatory, and advocacy worlds, with a heavy emphasis on the DIY efforts and entrepreneurship in the diabetes world. We remain committed to the goal to offer an experience that lets you learn, connect, and collaborate. So this is actually only our second ever online event. And of course, you never know what technology is going to do during these virtual gatherings. So please keep an open mind as we share this internet-enabled journey together today. So what are these events all about? Well, essentially, it's about addressing current hot issues in the diabetes world and exploring how those challenges are being met. So this dovetails quite well with the reporting that we do at our website, DiabetesMine, which of course has been part of San Francisco-based Healthline Media for 5 years now. So speaking of hot buttons, it is of course possible that during this program, some news may break about the election updates. Obviously, it'll be a while until the dust settles on the election, so it may take some days. So we'd like to spend today and tomorrow, nonetheless, concentrating on improving life with diabetes, even as all of this swirls around us. And we're honing in today on the hottest issues affecting the diabetes world. So clearly, the COVID pandemic is really defining our age. It's catapulted telemedicine to the forefront. And by all accounts, it is here to stay and particularly suited to diabetes care. So this prompted US News and World Report to recently ask, has the pandemic changed type 1 diabetes care for good? In that story, one leading NYU doctor is quoted as saying, it's quite clear from my clinical experience that people really like this telemedicine and they would actually prefer it. And I personally am one of those people for the most part. Part and parcel of this, of course, is utilizing digital tools to address whole person care. And in diabetes, of course, that means looking beyond just a focus on glucose numbers to address other existing health conditions and also mental health and day-to-day wellness concerns. So this mid-October Forbes story talks about the urgency to embrace a more holistic approach to using digital health technologies. And of course, a huge hot button is the current national and international awakening around racial disparities. There is a growing focus on boosting inclusivity and cultural sensitivity in healthcare. And there's a lot going on right in our doorstep now in the diabetes world. And we have a lot to share with you on this topic today, including the results of a recent DiabetesMine survey conducted with the help of advocates to hear the voices of people of color in this community. And of course, the ways that technology is enabling all of this progress is at the core here. So we're going to kick off today's program actually hearing directly from the Digital Medicine Society on the state of innovation in 2020. And for those of you who are anxious to hear updates on new CGM technology and closed loop technology in particular, stick around for tomorrow's program, our D-Data, that will definitely be looking at how CGM is coming of age. Our opening speaker tomorrow will actually be Kevin Sayer, CEO of Dexcom. And speaking of sticking with us, we have some healthy treats in store for those who stick it out for the full 2-day program. So at the end of D-Data tomorrow, we'll be issuing vouchers for some yummy free products from Teetus Teas, the makers of all-natural diabetes-friendly teas. and from Real Good Foods, who make some of the most delicious, low GI impact, gluten-free breakfast items, pizzas, and snacks out there. So we thank these companies for their generosity supporting this community. And speaking of thank yous, of course, we're beaming out huge appreciation to the sponsoring organizations that make these events possible, starting with our gold sponsor, Dexcom. We wouldn't be doing any of this without them. And I say this every time, but Dexcom has been at the forefront of enabling industry and DIY collaboration and really enabling the current sprint towards closed loop diabetes management systems. So we cannot thank them enough for how they've shaken up the diabetes world. And you can click on their logo at the center of our platform when we return to that view to learn more about Dexcom. And the same is actually true for our silver sponsors. A huge thank you to Lilly Diabetes, Insulet with the Omnipod, OneDrop, and Sanofi, all in their own way pushing the envelope for a brighter future, living with and successfully managing diabetes. Thank you all for that. Their logos will also be clickable on the platform here in Remo today. And of course, last not least, our bronze sponsors, a big thank you to Bigfoot Biomedical, to January AI, and to Glytech, who are all developing advanced technologies that will help people with diabetes maintain steady glucose levels no matter what type of diabetes they have or where they are in life. We always like to also give a quick shout out to these amazing organizations in the diabetes world that have been huge supporters of our work over the years. And we always like to highlight also who else is with us today. So this is a group of organizations represented on top of those that we already mentioned. It's very exciting to be able to bring you all together. So I hope you're all getting comfortable in front of your screens as we prepare to dive in. And before we do that, a quick orientation to the Remo platform that we're gathered on here today. Remo was, of course, built to simulate the experience of walking into a live event with a focus on networking. So you've all probably already realized that you can, you'll be dropped into a table and you can sit at any table that has an empty seat. You can move around whenever you like. You just double click on another table. And when no one is presenting, so when I go off stage, you'll automatically be in a mode where you're able to video chat with the people at your table. So you just need to make sure that your mic and camera are enabled. Right now, of course, because I'm presenting, those are disabled, but you will be able to see the chat window and talk to people either individually or in the group chat function. One important thing to know about here is this little icon that you see in the upper right. While anyone is presenting, you will be able to make the presentation slides big and get a much better view of them. Just be aware that you need to escape out of that view in order to get back to an area where you can see the chat and Q&A windows. So speaking of chatting, there are basically two ways to chat: the public chat that everyone can see, and you can also chat with people individually. You can click on the participants link here to see who's present, and then just click on their name to send them a direct message. And you can do things like, hey, meet me over at table 17 if you want, so that you would be able to chat with them live at some point during the program. While the presentations are going, please use the Q&A tab that will light up in green on the far right here to actually enter questions. And in this Q&A area, you can actually upvote questions, and we're going to be using that later today when we actually do some voting. So in case you have any difficulties, in case you freeze up, the first line of defense is to try double clicking on another table. So just move to another table. That should reset your icon. You can, of course, also refresh your page. Sorry. And whoops, this is moving around a lot. And these are the folks to get in touch with, Robin Smiley and Gary. You can also use the little need help icon in the lower left of the platform. The contacts here, Robin Smiley and Gary Borg, their information should also be in the email that you received to log in case you get locked out. Okay, and with that, I'm excited to kick off the day. Of course, we do have a hashtag. It's DBMine Summit. It is going to be a great program today, including discussions on, wait a minute, here we go, on new digital medicine policies, on telemedicine and whole person care, on diversity and inclusivity in the diabetes technology space, and on including our brand new survey on the experiences of people with diabetes who are also people of color. We're really excited to unveil those results to you today. And you'll also get a chance to roll up your sleeves and collaborate on patient care paths. I'm not going to say too much more about that. You'll see. You can access the full event program and the agenda on the program information button that appears in the middle of your screen on the floor plan. So thank you all for being here. And now, we'd like to get started with our opening perspective on innovation, implementation, and avoiding inequity, digital medicine in motion. We have with us Jen Goldsack, who co-founded and serves as executive director of the Digital Medicine Society, which is a nonprofit organization dedicated to advancing digital medicine to optimize human health. Their research focuses on applied approaches to safe, effective, and equitable use of digital technologies in the healthcare space. And Jen herself has a double master's in chemistry from the University of Oxford and in the history and sociology of medicine from the University of Pennsylvania, plus an MBA from George Washington University. And she is also a former Olympian and world champion silver medalist rower. So she is quite a force to be reckoned with. And we are privileged to have her working on the cause of digital medicine and joining us today. So let's welcome Jen. Thank you to Jen for that. There she is. We're inviting her up for live Q&A. Good morning, Jen. How are you?
Good. I enjoyed making my way to the stage.
Good. Excellent. So for those of you out there, I hope that you will post your questions in the Q&A tab. In the meantime, I would like to start by asking you a little bit about the nuts and bolts of what the society does. So are you, first of all, how do you vet new members? If there are smaller organizations that want to join, are they asked to sign some sort of, pledge to certain ethics? Do they have to show stats on their, the validity of their solutions? How does that work?
Amy, what a great question. So first of all, thank you for inviting me to be here. I was so inspired by your introduction, and I'm so excited for sort of the summit over the next couple of days. So interestingly, the membership unit at DiabetesMine isn't the organization, it's actually the individual. So we thought long and hard about how we thought we could make the greatest impact on the field of digital medicine. How could we most quickly sort of harness this technology that is sort of accelerating so quickly, being deployed so quickly, where there's sort of limited understanding, in some cases, what blind spots might be. And to us, it was to really sort of not just work with, but partner with individuals from all of these different disciplines, bring them to the table and sort of collaborate, do idea sharing. And what we find is it's sort of the level of sort of the individual who's truly committed a future that benefits patients. We haven't had to do any sort of vetting. We do sort of monitor things like our Slack, for example. There's, I think 1,500 folks who use that on an almost daily basis, sharing ideas. We're always eyes wide open to make sure it's a positive experience, but we've never had an issue with misinformation. We've never had an issue with someone sort of, shooting down another idea. And because we aren't tech focused, we're person focused, we've had a really great experience to date. So, so far, so good. Now, as I said, we do monitor it, but we have been very lucky so far.
Thank you. That's awesome. So we do have a question that came in. Great question. How do you involve patients and caregivers in the process of developing policy solutions and advancing the field of digital medicine?
What a great question. And I think you see it's Anna. Hi, Anna. I would say we take sort of a three-tiered approach to that. So first of all, our membership is absolutely open to sort of patients who want to come and participate in this conversation, whether that's sort of advocating and using your own sort of powerful patient voice to make sure that all of us are paying attention to it as we develop all of the things. Patients are sort of equal members and have an equal voice in every component of DiabetesMine. The second thing is we try and make sure that in a number of our sort of research directions, actually, let me correct myself, all of our research starts with the patient. All of our research, whether we're publishing a framework, whether we're publishing best practice guidelines, always start with the patient. It's not about the shiny object. It's about the patient and what we're trying to achieve for them. And then we have specific publications that actually address things like patient engagement, how to optimize that in the digital era of health, what's the value proposition to doing that. And patients are co-authors on all of those papers. They sit in our strategic advisory, our scientific leadership, and our research committee. And then the third tier is we actually have a formal partnership with our colleagues over at Savvy Co-op. That's the first patient cooperative. What we recognize is, in the same way that we want to have our sort of data science experts sitting at the table with our payer colleagues and making them talk to each other and understand each other's world, patients should be part of all of those conversations. But I would never profess that we are patient experts, but Savvy are. And so we have that partnership too to help us do sort of much more critical strategic thinking and make sure that we are as respectful and as impactful as we can be with our patient engagement. So there's a sort of a three-layer approach that we take there because we take it so seriously.
So let me just clarify. So does that mean an individual patient could join the society, or only through organized groups, like nonprofit advocacy groups?
Individual patients can, many have, and we would welcome anyone who is sort of passionate about moving this field forward and getting it right. So if you're on the line today, come on over and check it out. Membership has an optional donation of something like $50, and there's also a complimentary membership. This is not pay to play. It's about community, and it's about the science, and it's about using digital correctly in the service of improved lives.
Wonderful. Thank you. So this is a really great question I was going to ask you as well. Obviously, we're all very aware of expanding inclusivity and diversity. So the question is, how does the society consider and address disparities based on skin color and socioeconomics?
So again, thank you for the question. It's really important. We do this at a number of levels. So when we think about our membership and we think about our leadership, we have had tremendous success in bringing all of the disciplines to the table because our leadership is diverse in their disciplinary background. Increasingly, we've recognized while we have wonderful gender balance and while we have wonderful sort of disciplinary backgrounds and even different regional backgrounds, we aren't the best yet at sort of making sure that we are actively engaging folks from different socioeconomic status, although cost is never a barrier, and also different sort of racial and ethnic backgrounds. So that is actually one of our priority goals for 2021, to make sure that all of our programming, while probably better than most in terms of representation right now, our leadership probably better than most, we do not yet represent the patient population that we are here to serve. And until my dog agrees, and until we do, we won't stop. So that's one aspect that we do in terms of the membership and the community and bringing on the experts that we want to be leading the field. The second piece is around, what about the actual research? So I'll give you an example because I think tangible examples are sometimes better, Susan. We're actually, we have in press right now sort of a checklist, building on some of our previous work that proposed frameworks for the optimal evaluation of a variety of different technologies. We're now putting into place sort of a checklist, something like you would see for the PRISMA checklist if you were going to publish a systematic review, or the CONSORT checklist if you were going to conduct a clinical trial. We are promoting the evidence checklist. And one of the items on those checklists is, if you are developing a new digital technology, you should be expected to document that you were inclusive in the population in which you were testing it, and that you have actually thoughtfully addressed issues where performance might be different across different products. Certainly that's not going to solve all the challenges. There are still things like access to broadband, but it is front of mind, and we do try and do what we can, and we will never stop pushing on that.
Thank you so much. That's so important, and something we're going to address later in today's program. We have another question here, actually from Kelly Close, who's quite well known in our community. What capacity does the society have to take or participate in the research projects proposed? And also, can you share what percentage of those projects believe should be taken on? So,
Kelly, that's such a great question. We try and democratize that as much as possible and be bottom up instead of top down. It's certainly not certainly not my job to be deciding what's most important, but we do a couple of things. The most important one is, to our research committee, every one of our members can submit ideas for research topics. As long as that submission is complete and it's relevant to our mission, we then post that. We post that with a short blurb and invite all of our sort of several thousand members to, it's almost Reddit style, sort of upvote it. We don't have a downvote, but it's actually a 5-star, where is this on the spectrum? And when a project emerges that is clearly important to a critical mass of our membership, we sort of really try and support that. We try and get that off the ground. We have a research committee that supports it. Increasingly, one thing that is my job is actually doing the fundraising to be able to do that. We try and make sure there are sufficient resources to really do that well. And we draw the working group representative members from our community. So it's a really great question, and we're still learning about it. So Kelly, if you have ideas for how we can make sure that we are sort of identifying those most pressing challenges where we can be most impactful, I welcome them, because it's there's a lot to do, and triaging that list really is a challenge.
Okay, I'm going to jump on this one because it's kind of close to my heart, a communications related question. So as we've seen with COVID, accessible health information is crucial. The question is, how does the society encourage the communications PR professionals within the member organizations to ensure that the patient voices are heard about their solutions?
It's a really good question. And I pause because you actually sort of forced me to think about, are we doing enough? I think we probably rely on a number of levers. First of all, because we have extraordinary patients within the community, in the same way that I wouldn't come in and speak for a data scientist, I'm not one. I would always sort of pause if I see anything that looks like it could be incorrect or the patient voice is really missing. I'll oftentimes go and chat with one of our sort of, patient board members or one of our patient community and sort of get their gestalt on it and see if I am correct. Also, the sort of wonderful patient community we have are keen to lean into this. So oftentimes they will advocate sort of on their own, and they receive tremendous support from the rest of the community. It's interesting that you asked about sort of correct communication, because from my point of view, and I could just be misinformed, I've seen less about incorrect communication and more just an absolute absence of the patient voice altogether. And if there are tips and tricks about how we can make sure that the voice isn't only present but authentic, I'd love to hear, I'd love to learn.
Thank you. That's a great note to end on. Thank you so much for your efforts and for being here today. And now we're going to move on to a very related topic. So we're going to pop you off stage.
Fantastic. Thanks, Amy. Thanks, everyone.
Okay, so again, thank you to Jennifer Goldsack for that very informative talk. And now we're going to talk about telemedicine and how it is or can be applied to a holistic approach to healthcare. So we have with us an amazing group of experts from industry, care and payer organizations, and we're actually going to approach this panel a little bit differently than usual. So before I introduce and invite up these amazing women, I'd like to set the stage with sort of a temperature check on where we stand on these topics. So thank you to Nushin Hashemi and her team from January AI for compiling this information. There are some very notable trends around these topics that are worth walking through. So bear with me if I'm reading here a little bit, but consumer adoption of telemedicine has skyrocketed from 11% in 2019 to 46% now. And by the way, the sources for all of these are mentioned on the right. And if anyone's interested, I can provide the exact URLs. 33% of patients are saying they would leave their current physician for telehealth. 64% of providers are now more comfortable using telehealth. The global market for telemedicine is expected to reach $185 billion by 2026, which is up from $34 billion only in 2018. And the US is about 1/3 of that. 2019 data showing telehealth more effective than traditional care for people with diabetes in lowering their A1Cs. That's a big one for this community. And you may know that the FCC rolled out a $200 million telehealth program as part of the CARES Act recently. And also 83% of patients expect to use telemedicine post-COVID. So there's obviously some great potential here for telemedicine to deliver impactful care. So when we talk about holistic healthcare, though, what does that actually mean? Well, it encompasses all the different aspects of a person's physical, spiritual, emotional, financial, and behavioral realities. So there seems to be an awakening finally that trying to treat people for any health condition completely in isolation without taking these factors into consideration makes no sense. So there are some important, well-known social determinants of health, but there are also critical considerations for things like the availability of mental health support, education and learning, listening and motivation, addressing people's habits and their spirituality, and of course, the all-important care coordination. So who's doing it well? Well, here's one case study that Nusheen brought to our attention. It's an organization that is getting it right, marrying telehealth with holistic care. So this is Massachusetts-based Devoted Health. They're one of the 25 biggest and most innovative payers in the country. And they're investing heavily in finding out what individuals actually need. They've been called the Kaiser of the 21st century on steroids. And they've also been called a payvider. It's a kind of a combination of a payer and a provider. So the idea is that combining technology, telemedicine, and then physical support with things like rides to the doctor when people actually need to go in person, or coverage for over-the-counter medications, et cetera, is really helping. So they're both doing the right thing, then the humane thing, but they're also actually keeping people healthy and removing cost from the system. So as valuable as it can be, there are obviously a lot of key questions around delivering high quality holistic care virtually. And some of those topics are things like, how can telemedicine meet the emotional needs of patients? What about access? How will people who are less technically literate and less well off get into this remote care? What are some examples of great whole person care? What's missing from whole person care today? And what barriers are currently keeping organizations from providing whole person care? So keep those questions in mind. I'd like to tell you a little bit about our panelists who you're going to meet in just a few minutes. So Dr. Susan Bean is Executive Medical Director, VP and Executive Medical Director at Health First, which is one of New York's largest HMO health plans. She focuses on care management and clinical provider partnerships and does a lot of work specifically on diabetes care. She was previously CMO of Affinity Health Plan, where she helped that organization become a top performer in quality and member satisfaction. She's actually a Princeton and Columbia University grad and a strong proponent of collaborating with and engaging providers to improve health outcomes. We will also have with us Rachel Sanchez of OneDrop. She's Senior VP of Product, and she oversees strategy and development for all products and services for OneDrop. Rachel lives with type 1 diabetes herself, and she actually left a successful career in law to join OneDrop in 2015. She's a Harvard Law School grad and founding member of Women at Austin Angel Network. And OneDrop is, of course, the company with an award-winning diabetes management app, and also that super sleek glucose meter that's sold in Apple stores. They provide unique personalized management and coaching programs for diabetes, prediabetes, high blood pressure, or high cholesterol, and they're now also expanding into oncology, heart disease, and women's health. And Nusheen Hashemi, who I mentioned, is previously a corporate executive and investor and philanthropist. She is a Silicon Valley veteran who was part of the incredibly successful leadership team at Oracle, and is now an entrepreneur launching January AI, which is a company using AI and machine learning to prevent, predict, and postpone chronic disease through glycemic tracking and prediction that will lead to personalized recommendations. And we're actually going to get a demo of the January AI program tomorrow at the D-Data session. Nusheen works with a multidisciplinary team of scientists, doctors, and engineers to create a truly meaningful telemedicine experience, currently for those with type 2 diabetes. We also have Stephanie Telenius with us. She is founder and CEO of Vita Health, which is a virtual care platform that treats the whole person and a whole population by addressing a full range of chronic conditions and the behavioral conditions that accompany them. So Vita is already deployed at Fortune 500 companies and large insurance carriers and health plans around the country. And Stephanie herself is another tech maven. Before starting Vita, she led large consumer and enterprise programs at Google, eBay, and PayPal. And now, before we invite these experts up on stage, we're going to take a little break and let you all discuss first at your tables what core questions you might want to ask about these topics. So I'm going to stop presenting now and give you all a few minutes to chat at your table, to plug in your questions into the chat session about telemedicine and whole person care. And then we will transfer them into the Q&A area when we start the panel, and then you'll be able to upvote those questions. So that way we'll be able to pick up our panel right away by answering your questions right off the bat. So here we go.